5-hydroxytryptamine, or more commonly known as serotonin, is a monoamine neurotransmitter that has been popularized as being a contributor to the feelings of happiness and well-being. It is a chemical that is produced through the nerve cells, most commonly found in brain, bowels, and blood platelet, and serotonin is made from the essential amino acid tryptophan and must enter through your diet. This is what serotonin looks like. It has 2 amine groups, a hydroxyl group, as well as a benzene ring. Serotonin helps every part of your body both directly and indirectly. It helps anything from your emotions to your motor skills, all the way to sleeping and digesting. Serotonin helps in regulating mood in the levels which it is sitting at. When you have a high level of serotonin, you feel happier, and when you have a low level of serotonin, that's when you feel sadder. Serotonin plays a huge role in regulating sleep. Whether you wake or sleep is determined by which area is stimulated and which serotonin receptor is used. Blood clotting in our bodies is done by serotonin causing tiny arteries to narrow, helping form blood clots to heal wounds. Part of the reason we feel nauseated relates to serotonin. Production of serotonin rises to push out noxious or upsetting foods more quickly. Also, chemicals increased in the blood, which stimulates the part of the brain that controls nausea. Next, I would like to talk about how different levels of serotonin can affect us and what to do to either rise or lower these levels. When serotonin levels are normal, nothing really changes because, well, this is how you always feel. When you have normal levels, you should feel happy, calm, focused, and less anxious. Normal levels are not often talked about because at a normal range they tend not to be noticed because we feel fine and, well, we just think we are fine. Next, I would like to talk about serotonin deficiency, what it is, and how to treat it. Serotonin deficiency is just having a lack of serotonin or having low levels of serotonin. As we know, all the things that are affected by serotonin, having low level will affect your sleep, your mood, and everything. Things that can cause and contribute to serotonin deficiency are things such as like prolonged periods of stress, genetic factors, poor diet, toxic substances like heavy metals, pesticides, drug use, and some prescription drugs can cause permanent damage to nerve cells that make serotonin and other neurotransmitters disappear. There's also things like hormonal changes can cause low levels. Certain drugs, some substances like caffeine and alcohol can deplete the levels of serotonin in your body as well. There are many ways of treating serotonin deficiency. There are natural ways, and then there are drugs that you can use. Some natural ways to boost serotonin are exposure to light, exercise, meditation, and doing or seeing things that you like. Now, those 4 ways are all kind of activity-based. Some easy ways to do it around the house are just keep a schedule, like know what you're going to be doing, when you're going to be doing it, and eat more healthy foods, have a diet, eat more carbs, more vegetables and fruits, natural things. Wait, what is that? I'm glad you asked. See, serotonin syndrome is actually what happens when you have too much serotonin in your body, and this often comes from the drugs that are prescribed for serotonin deficiency. The symptoms of serotonin syndrome often start within a few hours of taking a new medication that affects serotonin levels, or increasing the dosage of one that you are already taking. Some symptoms include confusion, agitation, dilated pupils, headache, change in blood pressure, nausea, rapid heart rate, heavy sweating, and lots of other things. But in severe cases, serotonin syndrome can be life-threatening. There are symptoms that include high fever, seizures, irregular heartbeat, or unconsciousness. Serotonin syndrome can occur if you are taking medications, particularly antidepressants, that raise your body's level of serotonin syndrome. The greatest risk of serotonin syndrome occurs if you are taking 2 or more drugs or supplements together that influence serotonin. The condition is more likely to occur if you start a new medicine or increase the dosage that you are already taking. The most commonly prescribed class of antidepressants, which work by increasing serotonin, are called SSRIs. Also, like it stands for serotonin reuptake inhibitors. Since serotonin is only newly being researched, there's no way to diagnose it, there's no way to tell your body's levels of serotonin. So for treating serotonin syndrome, the only way we can treat it is to treat what the effects are on you, give you things to stop the seizures, and or whatever you have a high fever, ways to get rid of the high fever. So I hope we all learned what serotonin is, what serotonin can do, how high and low levels affect us, and what we can do to change those levels. I would like to say thank you for watching my video. My name's Owen. Keep learning. Have a good day.